Hey everybody, it's Dr. Greg Jones here at Innovative Wellness Center. So here we are. So you've talked to your provider, you talked about your symptoms, and wow, it looks like low testosterone. You do your labs, it's confirmed your testosterone is low, whether you're a male or a female. There are symptoms, you don't feel well, you know what's happening. So what do we do about it? So after you've discussed the benefits, the risks, the alternatives with your provider, it's time to talk about how to give you testosterone. Now there's 4 kind of known ways to improve your testosterone levels if you are doing bioidentical hormone replacement therapy, BHRT or TRT, testosterone replacement therapy. Now how do you do it? First is oral. I personally do not do oral. The molecule is huge, really hard on the liver. Kind of an old school thing to do. I personally do not give oral testosterone. Just have that discussion with your provider. Me personally, ain't happening. The next is topical creams. Now, what are the benefits of creams? Now, creams, there's no needles, no sharp objects. Some people are needle phobes. They want nothing to do with needles. Creams can be an option. Now, creams, that being said, no needles, no risk of infections, of inflammation, no sharp pokes, and your levels can be more stable because you are applying this cream to your body 1 or 2 times a day, most of the time once a day. Now, that being said, that application is actually one of the cons, right? Because if you are applying this cream, you're going to absorb it differently every day, depending on body temperature, body hair, how vigorously you rub, lots of different factors in there. The other thing I don't like about creams, this is just my personal opinion, you have to mitigate the symptoms of dihydrotestosterone or DHT a little more aggressively, meaning that the testosterone in the cream will convert to DHT quicker. Now, DHT is responsible for those testosterone side effects. So if you think about those well-known testosterone side effects, so you think about acne, hair loss, aggressions, prostate enlargement in males, excessive hair growth in women, so like the hirsutism, the official term for it, so getting hair above the lip, on the jawline, or under the chin, all DHT. Not a fan of that. And it spreads, so everything and everybody in the house is getting a little bit of testosterone, right? Your spouse, the cats, the dogs might get a really jacked puppy running around there because that is getting testosterone. Your blue light, you might have testosterone all over the house. So next is injections, so intramuscular injections. So what's good about that is once a week injection, or twice a week, depending on the protocol you're on. You're absorbing 100% of it, and if your levels are low, they are going to get where they need to be and optimize very fast, right? Because you're absorbing all of this testosterone. It's great. Now, what's the downside? It's a needle, so a sharp, pointy object always carries a risk. Now, testosterone in an injection form, IM form, carries its own side effect risks, and mostly it's the estradiol. Now, you can get elevated DHT, but in most cases, we tend to see the estrogen get higher, especially in our male patients when they're on injectable testosterone. Now, estrogen carries its own side effects, right? So high estrogen can lead to bloating, moodiness, affect your sleep, affect your body temperature, lead to gynecomastia, nipple sensitivity, a lot of really uncomfortable symptoms, including low libido and erectile dysfunction, right? And so you just have to kind of manage it, talk to your provider, and see what's best for you. Now, that doesn't mean you're going to be on injectable testosterone, just like it doesn't mean you're going to be on a topical and have these side effects. It's just a risk you need to be aware of. Last but not least, there are pellets. So pellets are, just like it sounds, pellets of hormones, right? We make a small incision in the back of the hip. Most of our cases here, we insert the pellets directly right there. Now, when those pellets are inserted, there's pros and cons of that. The pros is that the levels tend to be extremely steady because that pellet kind of dissipates over a period of 3 to 5 months, depending if it's a male or a female. And you kind of get more testosterone when you need it. So if you're working out or under stress, the blood flow increases, circulation increases, you get more testosterone in the bloodstream. That's great. Now, the downsides of that are if you have this pellet and your dose is incorrect, there isn't much we can do about it. It's in. I can't take it out, can't put more in. So you have to be very, very careful and very effective of dosing, right? So there can be a little bit of fine tuning as you go from pellet to pellet between you and your provider. The other thing about pellets is there is a risk of extrusion. So they can come out, pop out like a piece of toast. Not like a piece of toast, but at the same time, not fun, right? And so that you have to keep in mind. But at the end of the day, for people who travel a lot, it can be an option. And again, if you're injecting yourself 50, 52 times a year or 100 times a year, it can get a little bit overwhelming, get exhausted from it. Pellets can be an option. So keep that in mind. So at the end of the day, talk to your provider about it and decide what's best for you. This is Dr. Jones, and we'll see you soon at Innovative Wellness Center.